Want to pass your NCLEX? Then let's get started. Today we'll be covering 10 questions based on physiological integrity, a heavily tested topic during the NCLEX exam. Question 1. A client with heart failure is prescribed furosemide to manage fluid overload. The nurse understands that furosemide primarily works by increasing sodium reabsorption in the kidneys, inhibiting aldosterone secretion, decreasing potassium excretion in the urine, inhibiting sodium and water reabsorption in the kidneys. Pause the video and select your answer. If you chose option C, you are correct, hypokalemia. Furosemide is a loop diuretic that promotes potassium excretion, leading to hypokalemia. If you want explanations on the incorrect options, you can pause the video and go through those. Question 2. A client with COPD is prescribed oxygen therapy. Which of the following oxygen delivery devices would be most appropriate for this client? A Venturi mask, nasal cannula, simple face mask, non-rebreather mask. Pause the video and select your answer. If you chose option A, you are correct, Venturi mask. In COPD, the client typically retains carbon dioxide due to impaired gas exchange. The Venturi mask delivers a precise oxygen concentration and allows for titration of oxygen delivery while ensuring a controlled flow of oxygen. This is particularly beneficial for COPD patients who require a specific oxygen concentration without the risk of retaining excess carbon dioxide, which can occur with the other oxygen delivery devices. Question 3. A client is experiencing an acute asthma exacerbation. The nurse anticipates the administration of which medication to provide immediate relief? Albuterol, prednisone, montelukast, theophylline. Pause the video and select your answer. If you chose option A, you were correct, albuterol. Albuterol is a short-acting beta agonist bronchodilator used for immediate relief of bronchospasm in asthma exacerbations. Question 4. The nurse is caring for a client with diabetes insipidus. The nurse anticipates that the healthcare provider will prescribe which medication to manage this condition: insulin lispro, desmopressin, metformin, glipizide. Pause the video and select your answer. If you chose option B, you are correct, desmopressin. Desmopressin is a synthetic form of ADH used to manage diabetes insipidus by increasing water reabsorption in the kidneys. Okay, guys, we're halfway there. Question 5. A client with a history of MI is prescribed aspirin therapy. The nurse instructs the client about the rationale for aspirin therapy, which includes preventing platelet aggregation and reducing the risk of blood clots, lowering cholesterol levels and improving lipid profile, increasing cardiac contractility and improving myocardial oxygenation, decreasing blood viscosity and improving circulation. Pause the video and select your answer. If you chose option A, you are correct, preventing platelet aggregation and reducing the risk of blood clots. Aspirin inhibits platelet aggregation and reduces the risk of blood clots, thereby decreasing the risk of further MI or stroke. Question 6. A client is admitted with a suspected DVT. Which of the following assessment findings is most indicative of DVT? Increased pedal pulses, warmth and redness over the affected area, pallor and coolness of the affected extremity, Homan sign, calf pain with dorsiflexion of the foot. Pause the video and select your answer. If you chose option D, you are correct. Homan sign. Homan sign, characterized by calf pain with dorsiflexion of the foot, is a classic sign of DVT. However, it's important to note that Homan sign is not always reliable and can sometimes be absent even in the presence of DVT. Question 7. The nurse is assessing a client with chronic renal failure. Which of the following laboratory values is expected to be elevated in this client? Hematocrit, BUN, serum creatinine, serum albumin. Pause the video and select your answer. If you chose option B, you are correct, BUN. In chronic renal failure, the kidneys are unable to effectively excrete urea, leading to an accumulation of nitrogen waste products in the blood, resulting in elevated BUN levels. Question 8. A client is prescribed Coumadin therapy for the treatment of AFib. The nurse teaches the client about the importance of monitoring which laboratory value while taking warfarin: prothrombin time, white blood cell count, serum potassium, serum glucose. Pause the video and select your answer. If you chose option A, you are correct. Prothrombin time. Prothrombin time is used to monitor the anticoagulant effect of warfarin therapy. It measures the extrinsic pathway of the coagulation cascade. Question 9. The nurse is caring for a client with a closed head injury. The nurse understands that increased ICP can lead to which of the following complications? Bradycardia, hypotension, hyperthermia, Cushing's triad. Pause the video and select your answer. If you chose option D, you are correct. Cushing's triad. Cushing's triad is a classic manifestation of increased intracranial pressure and includes hypertension, bradycardia, and irregular respirations. Question 10. We made it to the end, guys. A client is admitted with diabetic ketoacidosis. The nurse anticipates that the client will exhibit which of the following acid base imbalances: metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. Pause the video and select your answer. If you chose option A, you are correct. Metabolic acidosis. Diabetic ketoacidosis is characterized by the accumulation of ketones and acid byproducts in the blood, resulting in metabolic acidosis. Click that subscribe button and join us next Wednesday.